Hi, my name is Samantha Selke, and I'm currently a student at Northern Kentucky University. Today, I'm going to be sharing my research on the gut-brain axis and what that means for clinical care. So what's the problem? Depression and anxiety significantly affect individuals' daily lives, their health, and their economic well-being. Research indicates that by 2030, depression may surpass heart failure as the most prevalent disease worldwide. Notably, anxiety and stress frequently accompany depression disorders, coexisting in approximately 75% of children and adolescents. Studying the gut-brain axis is crucial due to the rising prevalence of mental health disorders. Looking at the role the gut microbiome plays in mental health disorders could lead to new therapeutic avenues. It could also help with personalized treatment strategies and promote a more holistic approach to mental health. Emerging research does suggest that probiotics and prebiotics may serve as an effective adjunct to conventional treatment for depression and anxiety, potentially enhancing outcomes. This highlights the importance of personalized dietary intervention and the need for an integrative approach in mental health care. Right now, there is a gap in literature discussing what is the standard of care in order to support the gut microbiome in order to improve mental health. Insights gained from this research could facilitate in preventative measures, improving overall health for the population, while also fostering an interdisciplinary approach among fields like psychiatry, gastroenterology, and nutrition. So I decided to do my research on this because it's important to understand how mental health could be changed based on the gut microbiome. So my PICO question is, in adults with mild to moderate depression, how does weekly nursing education about gut health interventions improve depression symptoms over 6 weeks compared to those who don't receive nursing education? For my literature review, I looked at 5 research articles that discuss the gut-brain axis. 4 were randomized control trials, and 1 was a systemic review. The studies reviewed employed a rigorous methodology, primarily using randomized control trials designed to investigate the effects of probiotics and prebiotics along with dietary changes on mental health outcomes. In Chawana's article, published in 2019, it utilized a triple-blind, placebo-controlled approach with 71 participants categorized by depression severity, assessing both psychological metrics along with gut microbiota samples through patient stool samples. Although the overall mood improvements were not statistically significant, participants with mild to moderate depression experienced reduction in cognitive reactivity when receiving probiotics. In contrast, Schaub and their colleagues published an article in 2022 which focused on 60 patients with major depressive disorder, observing significant reduction in depressive symptoms in those receiving high-dose probiotic supplementation. This was measured using the Hamilton Depression Rating Scale. The study highlighted specific gut microbiota changes associated with the treatment, reinforcing the link between gut health and mood regulation. The other article Frehey and colleagues published in 2023 expanded on the scope to compare a high prebiotic diet against a probiotic supplementation in a larger sample of 119 participants. Their findings revealed significant improvement in mood disturbances, anxiety, and sleep quality in the prebiotic group, suggesting that dietary modifications may have a more substantial impact on mental health than probiotics alone. Finally, in the randomized controlled trial by Regnis and their colleagues published in 2020, they examined a multi-strain probiotic combined with biotin in 82 participants. Their findings showed improvement in psychiatric symptoms across both groups, but no significant difference between the placebo or the control group. This study highlighted potential issues, though, such as external factors resulting in inconclusive results and the needing for longer trials to assess for broader implication of probiotics on mental health. Collectively, though, these articles emphasize the nuanced relationship between the gut microbiota, the dietary interventions, and mental health, underscoring the need for further research to optimize treatment protocols and understanding underlying mechanisms of action. So, what are the outcomes of all of these research articles? First is the recommendation of probiotic supplementation. Probiotics use has been shown to have potential in reducing depression symptoms and improving gut microbiota composition, with some research indicating that they may positively influence cognitive aspects related to depression, such as cognitive reactivity. Second is dietary changes. High prebiotic diets have been linked to significant mood improvements, along with reducing anxiety and stress and potentially surpassing the benefit of probiotics alone. Such dietary changes can enhance gut microbiota and promote beneficial bacteria to grow, indicating a holistic approach in both combining dietary modifications along with lifestyle modifications and including the role of B7 supplementation in people's diets. The third thing is fecal microbiota transplantation. This presents another avenue, with the systemic review suggesting it could alleviate anxiety and depression by restoring a healthy gut microbiome. Though donor selection is critical in order to avoid adverse reactions, there is promise of this new application as it may help promote different treatments. There are still gaps in literature among these 5 research articles. First is the sample size and diversity. All these studies have small sample sizes and limited participants, limiting the ability to generalize across a diverse population. Second is the long-term effects. Most research focuses on short-term intervention, leaving unclear the long-term efficacy and the safety of probiotics and dietary changes. This is something we need to further investigate and do a longer research study on. The third is mechanistic understanding. There is insufficient exploration of the underlying mechanisms through which the gut microbiome affects mental health, particularly which specific bacteria influence mood or behavior. We need to look at specific strains of probiotics too in order to understand their effects. Finally, the interaction effects. There's limited studies that talk about combining multiple interventions, such as probiotics with dietary changes or probiotics with different medications. This is something that we need to start looking at and researching in order to provide a better holistic care. So what are the next steps? I first recommend dietary patterns and changes in gut health. We need to investigate the different impact of various diets. So this looks at Mediterranean diet, ketogenic diet, high fiber diet, and what that does to the gut microbiota composition and mental health outcomes. Also understanding which diets are most beneficial for each individual patient and how it can guide therapeutic approaches. The next is patient-centered research, including qualitative research to understand patients' experiences and preference regarding gut health interventions. Also, integration with other treatment. We need to look at the effect that combining gut health interventions with current healthcare models such as psychotherapy or pharmacotherapy to evaluate the synergistic effect. And finally, I mentioned this prior, but strain-specific research, exploring the effects of specific probiotic strains and their combination. Different strains may have a unique benefit, and identifying which is the most effective for specific mental health conditions. I hope this research was interesting, and if you have questions about anything I discussed, please reach out to me. I attached my references here, and feel free to look over them, and like I said, reach out if you have any questions. Thank you so much for listening. Have a great day.